You know that painful twist, that sudden ouch? Yeah, we're talking about ankle sprains. It's got to be one of the most common injuries out there, but here's the thing. Treating it like it's just a simple misstep, that can lead to some really serious problems down the road. So today, let's break down what's actually happening inside your ankle and why walking it off might just be the worst thing you could possibly do. Come on, we've all been there, right? You're out for a walk, maybe playing a sport, or you just step off a curb the wrong way and boom, that feeling. Your first instinct? It's almost always to just, shake it off and keep moving. But is that really the best move? Let's dig into that. Okay, so what is an ankle sprain, really? First off, it's not about your muscles. Nope, this is all about the ligaments. Think of them like these super tough, kind of rubbery bands that hold your ankle bones together. When you twist or roll your ankle, you're basically stretching those bands way past their limits. Or worse, you're actually tearing them.
And that brings us to our first big point. It feels like such a simple injury, right? But believe me, the story of a sprained ankle can get really complicated really fast.
And why does this matter so much? Well, it's because these things are just so incredibly common. I mean, it doesn't matter if you're a pro athlete or you're just carrying in the groceries, this can happen to literally anyone at any time. We're not talking about some rare, bizarre injury here. This is a part of everyday life for so many of us. All right, and this gets us to the absolute heart of the matter, the danger of just ignoring it. This is the moment where a simple sprain can start to morph into a serious long-term problem. Now, this is a super important distinction to make. An acute sprain, that's the one-time event, the twist, the ouch, the swelling. But if that doesn't heal the right way, it can lead to what's called chronic ankle instability. The best way to think about it is like a door hinge that's gotten loose. The problem isn't the one time it got banged up anymore, it's that now it's just permanently wobbly and weak. And once that happens, a whole bunch of hidden dominoes start to fall. We're talking about way more than just being a little sore. An untreated sprain can lead to an ankle that constantly feels like it's about to roll over on you. You know that awful giving way feeling? And over time, all that instability causes a ton of unnatural wear and tear on the joint. And guess what that can lead to? Yep, early arthritis. So the big takeaway here is this. How you handle that initial sprain in the first few weeks could literally impact the health of your ankle for decades. Okay, so now you know the risks, but how can you tell if your sprain is something you need to take seriously? Let's go over the warning signs to watch for.
I mean, this is the million-dollar question, right? How do you tell the difference between a minor injury that'll heal up with a little rest and something that really needs a doctor's attention?
All right, think of this as your checklist. If you have major pain, swelling, or bruising right after it happens, that's sign number one. But the real red flags are the ones that stick around. If you find yourself spraining the same ankle over and over again, if it just feels wobbly or keeps giving way, or if you're still feeling that pain months later, please don't just ignore it. That's your cue to go see a specialist.
Okay, enough about the problem. Let's talk about the solution. If you do have a more serious sprain or that chronic instability, what does the path to getting better actually look like?
So here's the roadmap to recovery. It usually starts with the basics you already know, right? The RICE method: rest, ice, compression, and elevation. After that, a doctor might put you in a brace and suggest some anti-inflammatory meds. If things aren't getting better, they might want to do an MRI to get a clearer picture of what's going on. And then comes the really important part: physical therapy. That's where you rebuild all that strength and balance. Now, you'll see surgery is on this list, but look where it is. It's the last resort, not the first stop. And yeah, that brings up a huge question that I'm sure is on your mind. The word surgery can sound pretty scary. Is it something you're definitely going to have to do?
And the answer, thankfully, is a big no.
The good news is that for most people, a really solid physical therapy program and the right kind of bracing is totally enough to get that stability back. Surgery, well, that's really safe for the most severe cases where the ligaments are just torn up, or for that chronic loose hinge problem we talked about that just isn't responding to anything else. Okay, and here's the other big one, especially if you're an athlete or just an active person. You start to feel a little better, and you are just itching to get back to your sport or your routine. So when is it actually safe to do that? Listen, the advice here is super clear, and you really can't cut corners on this. You have to wait until the pain, the swelling, and that wobbly feeling of instability are 100% gone. The single biggest mistake people make is jumping back in too soon. Your ankle might feel okay, but those ligaments aren't fully healed or strong yet, and that just makes you a prime target for another injury, which could be even worse. So let's wrap this all up. After everything we've talked about, the risks, the warning signs, the treatments, what's the real goal here? I'll tell you, it's about so much more than just making the pain go away. And that right there is the main takeaway. Taking proper care of your ankle isn't just about healing a simple injury. It's about reclaiming your confidence with every single step you take. It's about making sure that one little misstep today doesn't end up dictating how you get to move for the rest of your life.